Hello, I'm Jackie McRae. As a qualified speech and language therapist with a PhD in dysphagia, I'd like to discuss the importance of early screening for dysphagia in the ICU. Let's look at why early screening for dysphagia is essential to optimise patient outcomes. Dysphagia is a common yet frequently under-recognised problem in the intensive care unit. Post-extubation dysphagia can be present in up to 2/3 of patients. The causes of dysphagia can be related to admission diagnoses, for example neurological diseases, comorbidities, and the treatment in the ICU itself. Post-extubation dysphagia prolongs ICU and hospital stay, increases rates of nosocomial pneumonia, and increases all-cause mortality. Therefore, early screening is essential to identify potential swallowing problems. Early detection will ensure that patients receive safe, appropriate, and timely nutritional care, leading to improved clinical outcomes. But let's speak in practical terms. I want to walk you through a patient case to show you how I screened for dysphagia. This approach considers the relevant clinical and patient-related factors to globally assess overall dysphagia risk and how we can subsequently manage this in clinical practice. If we think about our patient, Mr. Smith, as an example, he is a 66-year-old gentleman who has been admitted to ICU following a fall. The team are keen to start him on oral diet. He has Parkinson's disease and has been steadily declining physically and cognitively. He hasn't had any previous reports of dysphagia. He now has a chest infection and needs some non-invasive respiratory support. Let's look at the checklist found on the first row of patient-related factors. Mr. Smith needed surgery to fix knee damage and was intubated with an endotracheal tube for less than 24 hours. So box 1 for low risk. He is receiving non-invasive ventilation currently while he recovers and has some cognitive impairment, so these are box 2, medium risk. Mr. Smith is over 65 years old with frailty and has a progressive disease, although no previously reported swallowing problems, so box 3, high risk. Now let's look at his clinical risk factors found on the second row of the checklist. His voice is weak, but he is able to swallow his saliva. His mouth is really dry and he asks for water, so these are in box 2, medium risk. You ask him to move his lips and tongue in a range of normal and exaggerated movements, and notice some reduced range of movement, suggesting weakness, but no asymmetry. I would tick box 3 as a possible risk. Looking at the checklist, he shows some signs of high risk, but mostly elements of medium risk are present. So you decide to proceed with oral trials. Start with water. He is awake, alert, and sat upright. You follow a local water protocol policy and start by giving him 3 ml of water, which appear to be tolerated well with no adverse response. So you continue to 5 ml, then 10 ml. At this point, Mr. Smith starts coughing, so you stop. This suggests that although he doesn't have strong risk factors, his swallowing function may be weak, and he quickly fatigues, in keeping with his Parkinson's disease. It's best to refer to a speech and language therapist who can guide optimum textures and strategies to improve his swallow strength. A patient can fulfill the criteria of different risk groups at the same time. In this case, clinical judgment is essential to decide which risk group the patient is best placed. You may also discuss the decision with the support of a trained specialist, such as speech and language therapist, and the medical team. Okay, the next step is to follow up the appropriate management plan for the specific level of risk, in this case involving the multidisciplinary team members. Mr. Smith would benefit from nutritional supplements to maximise his intake, so you contact the dietitian. You continue to provide regular mouth care and moisturisation to manage his discomfort from dry mouth and feelings of thirst. Once you've ensured referral to an appropriate nutrition expert, such as the dietitian, they can assess the patient's nutrition risk and define an appropriate nutrition care plan. Those with dysphagia have increased nutrition risk and should receive an appropriate and timely nutrition assessment and care plan.
Fresenius Kabi offers a wide range of nutritional solutions for patients with dysphagia. This includes a range of high-energy and protein oral nutritional supplements in various flavours. Dietitians and healthcare professionals can choose between our texture and non-texture modified products. The texture-modified oral nutritional supplements meet the International Dysphagia Diet Standardization Initiative (IDSI) terminology. For those requiring enteral nutrition, a range of high-protein tube-feeding solutions are available.